We're looking at this week's health headlines, including a study about sleep and calories. Our morning news medical contributor and Northwestern medicine physician, Dr. Lauren Streicher, is here. Good morning.
Good morning.
Good morning.
All right. So what about increased sleep and calories?
This is so interesting. I mean, it's not news that if you don't get enough sleep, if you don't get that all-important 7 hours of sleep, it's going to sabotage your diet. But this new study looked at, okay, if we extend sleep, how many less calories are you going to take in? How much weight can you really lose by extending sleep? So in this study, 80 people, what they had in common is that they were all overweight and they were all only getting 6.5 hours of sleep a night. They didn't change their diets, they didn't have them exercise more, but 40 of the people, they put them on a strict sleep hygiene program so that they got 8 hours of sleep. They took in 300 less calories a day, which doesn't sound like a lot, but that's 30 pounds in 3 years, just by sleeping longer. So I don't know about you, but I'm working on the shut-eye now.
I wish I could sleep that long.
Yeah.
I mean,
But
that's the
they didn't give
problem.
them sleeping pills or anything. They just did all these, sleep hygiene things where they gave them a sleep mask and they didn't do social media into the night and they weren't reading the New York Times at 2 in the morning. And they slept more and they lost weight just
Interesting.
based
All
on
right.
that. Yeah.
Estrogen and COVID.
Well, we're always looking for explanations of why some people get sicker than other people. So this was a Swedish study that looked at 17,000 women that were between the ages of 50 and 80. And they divided them into 3 groups: those that were taking postmenopause estrogen replacement, those that were not taking any estrogen replacement, and then the third group were women with breast cancer that were actually taking drugs to eliminate all the estrogen from their body. And they looked at the people that got COVID, and what they found is that the women who were taking estrogen had a 50% lower chance of dying from COVID. So this is really important because what we know is the over 50 crowd is at high risk anyway, but certainly the crowd that's not taking hormone therapy is at even higher risk. So if there's anyone out there who still needs convincing about getting vaccinated, certainly if you're a woman over 50 who doesn't take hormone therapy, this would be really important.
What about the vaccines and fertility?
A few weeks ago I talked about the idea of if you get vaccinated, is this going to mess with your menstrual cycle? And the study shows no, not in any significant way. But there's still this belief out there, this concern that if you're trying to get pregnant, that you shouldn't get vaccinated because it might decrease your fertility. So in this study, they looked at 800 in vitro fertilization cycles to see if getting a COVID vaccine impacted on the ability to get pregnant. And what they found is that 74% of the unvaccinated got pregnant. 74% of the vaccinated got pregnant. There was absolutely no difference. There was no change in miscarriage rates. And they also looked at the guys, the vaccinated and unvaccinated guys, no change in sperm count, motility. So bottom line is absolutely the vaccine does not impact on fertility. Not to mention that if you get pregnant, we know that you have a 70% increased risk of dying if you get COVID. So another group that just really needs to get vaccinated.
And our last topic, ovarian cancer.
Ovarian cancer is often called the silent killer because a lot of women don't experience any symptoms early on. And there have been studies that have said, well, maybe actually women are experiencing these symptoms, but they're just not paying attention. So a new study came out looking specifically at women that were diagnosed with an early ovarian cancer, when of course it's the most treatable. And what they found is 70% of those women in retrospect said, yeah, I did have a symptom. Mostly lower abdominal pain, pelvic pain, sometimes bloating or gastrointestinal symptoms. But here's the scary part. 50% of those women, when they went to the doctor to complain about those symptoms, they were just kind of brushed off. They were told, oh, maybe it's a gastrointestinal problem, or maybe it's stress, or there's nothing wrong with you at all. So these symptoms can be red flags. And the bottom line is if a woman is having persistent lower abdominal pain or bloating, most likely she does not have ovarian cancer. But it is certainly worth getting screened to make sure, and then she can go on and find out what is causing those symptoms.
All right, for more, you can follow Dr. Streicher on social media. Thanks for being here.
Thank you.
Thank you. Time for Around Town.
Hey, Anna.